Welcome to the office. So you're coming all the way from Seattle.
Yes.
Is that correct?
Yes. Yeah.
And we have a few major issues we need to deal with.
Yes.
Yeah? Number one issue is
Knee and hip.
And the hip. Started when?
2015.
2015. What happened 2015?
I fell at work.
Okay.
Fell forward, landed on my knee,
Okay.
and in 2015, I worked through the whole year. I didn't feel no pain until April, May in 2016. I start feeling that pain on my knee,
Okay.
and it shoots up to my hip.
So it starts in the knee, left knee, it goes up into your left hip.
Yes.
Do you get back pain in the center as well?
Yes.
Yes.
Really
Do you-
bad.
Okay, and this has been since 2015
Yes.
or 2016.
Mhm.
Okay. Now, so from then to now, what are you doing for it?
Nothing. Just I was going through physical therapy
Okay.
for the hip and knee, and all they said is they can't do anything anymore.
So there were X-rays taken,
Yeah.
images were taken.
Mhm.
This happened at work,
Yes.
and so you went through the process.
Yes.
You had physical therapy, which was prescribed to you.
Yes.
Was anything broken?
There was nothing broken.
Was anything torn?
No.
So
was nothing
what were you told
torn.
is your issue then?
Or they said that there's arthritis.
Okay, so you have
On my
arthritis in your knee.
Yes. They said
And-
that I have arthritis on my knee.
Okay,
And
but you didn't get arthritis at work.
no.
So you had some arthritis in the knee, you had a fall at work, and it caused you pain later.
Yes.
Got it, I just wanted to
I
be clear.
didn't know I had arthritis until that fall.
Okay,
So I'm like, when they told me that I have arthritis, I was like, no, I was working. That should have given me some kind of pain, before the fall,
arthritis?
Yeah.
Well, that's something we can talk about later, okay, in terms of what arthritis is. And it is also used loosely out there in terms of what is it. Arthritis means an inflamed joint, right? Inflammation of
Yeah.
a joint. But by the time you see it on an X-ray, when you see the white calcium, that's not arthritis anymore. It's arthrosis, and it's spondylitis or calcium buildup inside the joint, right? Okay. Now, so that's the number one reason you're here.
Yes.
You flew or drove from?
I drove.
That's a long drive, lady.
Yes.
But you have some family with you to help you,
Yeah.
right? Okay. So what we're gonna do today is I'm gonna watch you walk. Okay, after the walk, I wanna go over your X-rays, tell you what I see, and we'll examine you and get started.
All right.
Now, I gotta mark your dimples, okay? Because everyone has been asking me, where are the dimples, Doc? Like, Doc, where are the dimples? I don't know what you're talking about. And then I did something a little bit funny today, but it's okay, on the other patient, and we're just gonna make a happy face. Okay? Now, I want you to walk several times back and forth, please. And let's just make sure that, so your dimples are actually moving up and down. That's pretty cool. Keep walking. Keep walking several times. So they move up and down, but you can see how the whole thing shifts to one side. And that's about it. You start to get tired. Pain or tired?
It's the hip.
Hurts.
Yeah.
Stuck?
No.
Okay. The left hip, this is the left hip, this is the right hip. Okay, this is the sacrum, this is the pelvis is here. You can see the right is significantly shorter than the left. It's almost like, so your pelvis is tilting like this, jamming that femur into the acetabulum, into that hip socket. The
That's
question is, how long has it been there? That's not 2015, that's a long time. That's a long time ago. But we'll figure it out, okay? But what I'm trying to show you is, first is we do have a severely tilted pelvis, right? We have a pelvis that's tilted. The right side is down, the left side is up. And let's go to the numbers so you can see it a little bit better. And this will make a lot of sense now. 264, 256, 70, 68. But here's the big thing, 20.4 millimeter leg length discrepancy. Anything under 7 millimeters, adjustments hold. Anything above 7, we have to see how much we can fix versus do we have to put in some sort of lift on that side. Now, follow my process. 264, 256, that's the bigger number, right? Now, the way this thing is misaligning, the right side goes down and slightly out.
Wow.
Okay. The sacrum rotates on the left side. So the pelvis wants to go to the left, your foundation. But you have a drop leg of 20, so it wants to bring you right back to that right side. Does that make sense?
Yes.
So you're going one way and then you're hitting the right and then you're hitting the left. With that femur being up inside the acetabulum, doing that every day for how many years, things will wear out.
Okay.
Does that make sense?
Yes.
So what we have to figure out is how are we going to get this pelvis balanced. Okay? We have rotation on the left sacrum. We have a pelvis dropped on the right, okay, which means the left is up. The difference in the numbers here tells me I may be able to correct it, 264, 256, 89, maybe 4 millimeters with an adjustment. But we need what? We need about
a lot more.
14 to 15 millimeters up, okay? Now, what we'll do today, we're going to examine spine.
Okay.
We're going to examine spine, pelvis. Pelvis means your hip. Hip is connected to that, right?
Okay.
We're going to figure out where we're going to start today.
Okay.
Okay? And then what I will do is we'll send you for the knee x-rays today or tomorrow before the next visit. We'll need to see exactly what's going on inside, and then I can give you a better idea of the knee.
Okay.
Today the focus is the pelvis, the foundation.
All right.
Okay? Based on that, you can see what? Now here's the good news. This is dropped on the right, but it did not produce any curvature issues in your lumbar spine. That's the good news. Okay? As you go up, now I want us to point out a few things. You can see like there's a lot of stress on your bones right now. Okay? So they're almost, instead of being square, they're kind of splaying out like this. Okay? And why I'm showing you that, it tells me there's been a lot of stress on your spine for many, many years. You see the edges here. This is straight. Look here. This is straight. This is concave, almost like it's squished. So the bone should be a nice, almost like a square, right?
Yeah.
Yours goes like this, like
then
this,
on this
and then it goes like that.
Curve.
Yes. Now, what does that mean? That's nothing for anyone, no one's fixing any of that. That's just telling you you've had a lot of stress on the spine, okay? There's a lot of weight on that right side.
Okay.
And it makes sense now, right? Because the right side is the short leg.
Yeah.
And you've had it for many, many, many years.
So it didn't just happen.
No, it didn't just happen. So look, all your bones are concave
Curve
on the
on the
right side on your short side. So madam, you're standing like this all these years. There's extra weight being put on that side.
I see.
And so that's been developing over the years, and then you had some fall at work and it just exacerbated the condition. Does that make sense?
Yes.
Okay. May I continue, please?
Go ahead.
T1, T2, T3, T4. So T3, T2, we have a little bit of a side slip situation. T2, that's something different also. T2 is the upper back. And we have a lateral shift of T2. They typically misalign back. When I see a lateral shift, that was also a trauma, whether it was something hit you from that side, shifted it hard enough, or jolted. Could it have been also from the fall? Possibly. But it was something that made it go like that, this way. Okay, it was
That's probably why I get that pinched nerve.
that's what you feel there?
Yeah, like a pinched nerve above my shoulder.
So that's the area we're gonna need to address as well for you, okay? Does that make sense?
Yeah.
Your upper cervical looks beautiful there. Those discs are beautiful, the capsules. Let's go to the side profile and see what we find here. Okay, there it is, right there. Okay, madam. So, your tailbone is here. It goes like this. And then you have that nice nub right there. Do you see that? It should be a smooth arc.
I think I fell on my tailbone somewhat.
Again, I'm just pointing out what I see, ma'am. I'm telling you what I see. So now things are going to start jolting your memory, I think, right?
Yes.
Okay, so we definitely have something down S2, S3. From S2, S3, we have little wedging of L5. 4, 3, 2, those discs are good. Now, you can see here there's calcium, calcium, calcium. Body's trying to fuse the instability, okay? In the neck, C2, C3, and 4 want to come together also. Now, here's the good news in your neck. Your neck curve is decent. It's pretty nice. I'm happy with that.
It's painful. It hurts.
I understand. I'm just letting you know. You have a decent curve there. Okay. Let's have you stand up and walk again, please. Let's have you walk. Watch your dimples again. So the dimples do go up and down. And we know we have a short right leg, but the pain is on the left. And we know that there's also a drop on the sacrum. So we need to address where we're going to start today. And all of this could be secondary to an upper cervical issue.
Could be.
It could be.
I'm just hoping.
Let's see. Starting at the base of the neck. And the first thing we're getting goes over to C3, C2, but it comes all the way. This is a right atlas 10 points. T2, T3, left side, 6, 7 points. Points around T9. 7, 8 points. 10 points. And there it is. Let's start here. There it is, S3, right there. So I'm getting pressure around S3. I'm getting pressure around T9, T10, ma'am. I'm getting pressure at around T2, T3, and I'm getting pressure around C1, right side. Those are 1, 2, 3, 4 spots we're getting. Now, let's go ahead and feel the pelvis. Scoot forward, please. Feet together. Open and close your knees. Open and close. Right side only. Left side only. Right side. Left side. So when she does the left, the right wants to go with it. Do the right side, please. When she does the right, I'm feeling it at the sacrum. Here. Do you feel that, ma'am?
Yeah.
Okay. Now, let's feel between, what is it, L5, S1, 2, or 3, okay? Let's start at 5. This is 5. Okay. S1. S1. S2. S3. Here. You have a high pain threshold, lady. You take a lot of pain, don't you?
Yeah, I did.
There it is. So this is actually a C2 on the left, a C1 on the right, ASRA right there. Do you feel that, ma'am?
Yeah.
Head down, please. I do have to poke around a little bit, okay?
Yeah.
Bear with me, please. 7, 1, 2 more tender, 3 more tender. 2 more tender, 3 more tender.
3.
6, 9 more tender, 8 more tender. 9 more tender, 10 more tender.
8, I think.
All right, my dear. Talk to me.
I felt that, I think everything that you press in,
Yeah.
it's like pinched nerve. Like, I
Well,
can't feel the pain that much. It's just it's like pinched nerve every time you.
You can feel what I'm doing.
Yeah,
Right?
but I can feel it.
Okay, sit back for me, please. Back towards me. C7, T1, T2, T3,
Ouch.
T2,
2.
or 3,
2.
2. C1, right, T2, I'm gonna wait on T9, and we're gonna do the sacrum, S3. That's where we're gonna start. Then I'll have you walk, retest, then we'll figure out the next step.
Okay.
And we're gonna start T2. I want you to see, we're gonna do T2 in the chair. 1, 2. So let's start T2 here. T2 in the chair. T2 as a PLS. There we go. You okay, ma'am? Okay. T2. Bring that chest back. Bring the shoulders back. Hands on your lap, please, dear. Relax the shoulders. They'll just open it up. Good. Good. T2. Home run. Gotcha. Give that a second now. Give it a second. Breathe, breathe. Let's do the sacrum. You ready, ma'am? All right. Now, we gotta get this power. You need some power in that left hip, right, ma'am?
Mm-hmm. Yes.
Now, my thought process is torquing it counterclockwise to help bring a little bit of that right hip up, okay?
Okay. Oh.
Gotcha. You okay?
Yeah.
Give that a second. Here, let me give you the stick. Have a seat. You okay there?
Yeah.
Can you stand up and walk once for me, please? Let me know if anything is different without the stick.
Oh. Feel lighter.
Keep walking.
No, I can't walk.
That's okay. That's okay. A little bit. It's a little different, right?
Yeah.
Okay.
Yeah.
Let's see. Now let's go ahead and do the analysis. C1 ASR.
Ouch.
Home run. Give that a second, okay? Deep breathing. In through your nose, out through your mouth. Deep breathing. Now, stand up fast. Use your cane if you need it. Cool. Walk. Check out what the Atlas just did for you. Now, the only thing different from that The previous walk is I adjusted your C1, your atlas.
Okay.
Tell me what's different.
My whole top, I feel a lot lighter.
Okay. Walk one more time and have a seat, please.
Walk a little easier, but I still have that.
Sure. Have a seat over here, please.
Woo!
Sit up straight, please. Lady, your ear popped louder than some people's cervicals, yo. That was good. That's gonna help
What
your
is the ear for?
balance,
Oh.
listening to your doctor. That was a joke. There are 3 bones in the ears, incus, malleus, stapes.
Mm.
So we were at the right atlas is clear.
Okay.
T2 is clear. I didn't touch T9, but let's see what happened. T9 is clear. Sacrum is clear. Now, feel this. Come back towards me. Tell me the difference. That's 5. S1. S2. Nice.
Nice.
It is, you're feeling it move, right?
Yes.
Good. Muy bueno. Muy bueno. Take your walking stick, please, and walk once back and forth. Tell me.
Amazing.
Different.
A lot different.
Now
A
have
lot better when I first came in.
Good. I want to make sure she sees. You're bringing that hip up. That knee
Yeah.
up.
But before I drag it,
Walk. Let's see. Sit and stand 5 times, please, on the chair.
oh,
Sit and stand 5 times by yourself. Sit. Stand up, please. Oh, you can get in the cane or the walking stick. All right, good. Good, good, good. And take the walking stick and walk one time with it. Squeeze it. Elbow, radial head. Nice.
yeah.
Squeeze. Squeeze.
Oh, shh.
And
Whew.
5 times fast. Squeeze hard. You do feel the difference.
Yeah.
Squeeze hard. Squeeze. Questions? Sure. Welcome
Thank
to
you.
the office.
Thank you.
You're welcome. We're here, visit number 2.
Yes.
Tell me how you did.
I felt a lot better. I was sleeping really good last night.
Okay.
I usually don't get sleep. I hardly get any sleep because of my neck. I have a lot of problem with my neck, and so is my hip and knee.
Right.
Last night, my hip and knee, I was still have the pain, but actually my neck, I was having.
So the neck felt better.
Yeah, the neck felt a lot better.
Was there any change in the low back or hip?
Yes.
Okay.
The lower back,
Okay.
yeah, it felt a lot better. I could stand more than 3 minutes.
Okay.
Usually when I stand, I was having so much pain on my lower back,
So you can stand now for how many minutes?
more than 5 minutes.
Okay. And then I gave you a pedal machine.
Yes,
the
I was
pedlar.
I was doing that, and I did it this morning before I left,
Okay.
and it was pretty good.
Okay.
You know, last night I was doing it before I went to bed,
Okay.
and then I woke up this morning and I
Okay.
did it again.
This is good.
Yeah.
Now, we're going to add one other variable with this pedlar machine. One of the best rehabs for the knee that Dr. Gonstead used to give his patients back in the 50s
Okay.
and 60s was pedaling backwards.
Okay. Yeah, I
And
was doing
you're
the
doing
front
that.
and the back. Yeah.
Okay, so what we're gonna start today, you'll do what's called a 2-to-1 ratio.
Okay.
So for every 5 or 10, let's say 10 minutes forward, 5 minutes backwards.
Okay.
Now the backward, no resistance, we just want the movement.
Okay.
And the idea with the reverse bicycle is it helps reset the Q angle, because when we're looking at the knee joint is composed of what? The tibia and the femur, right? Let me grab the knee model. So if we look at the knee model, this is representing the right knee, okay? This is the tibia, this is the fibula, the bone on the outside, this is the femur, and then we have the patella.
Okay.
Now, for proper alignment of the knee, we need proper alignment of the knee. We need the tibia and the femur to be in proper alignment so that the patella has good tracking. If we have misalignment of the femur, we have tracking that's off. If we have misalignment of the tibia, we have tracking that's off. And over time, you get more wear and tear, which leads to degeneration. Now, someone who's had an injury on the knee, we're comparing both knees. So we're sending you for an AP comparative standing X-ray, and then the lateral to make sure there's nothing in the back, no Baker cyst or flabella or anything like that, any anomaly in the back of the knee. Okay?
All right.
Starting at the base of the neck, let's see what we got today. So we worked on her ASR yesterday, C1. We got a tiny bit up top today, 5 points. Hold on, watch this. So it looks like it's breaking there, but it goes up still and shifts over to the right. So we still have a couple of points on that ASR. T2, much better. Tiny bit. We're going to continue on. And the idea is hopefully we're not jumping around too many segments with you. We're sticking to the main ones. Okay. And hopefully today I can go a little bit more today for you. Now, same 3 spots, okay? T9, 10 area, we had a little bit of pressure there that cleared up. Today there was a little flutter, but we're not messing with it, okay? We're gonna continue on. Let's go back slowly towards me. That's L5. That's S1. That's S2.
S
And that's S3. That's
2.
Yeah. So this is where we were at yesterday, but compared to yesterday, there's a lot more movement.
Yeah.
Yeah. T2, S2, 3. Sit back for me, please, dear. And tiny bit on C1. Okay? So we're going to continue. We're going to do C1 on the right. We're going to do T2 on the left. We're going to go there, do the sacrum.
Okay.
Then I'm going to have you walk. I am going to start tuning up the ankles today.
Okay.
Okay?
Thank you.
You got it. All right, showtime. ASR. So coming down from the mastoid, sliding forward in front of the SCM, right on the C1, right there. Okay, and now we just want to get that locked out nicely for you. Good.
Oh.
And that's a home run, baby. Beautiful. Wait a second. Deep breathing, please. Muy bueno. Deep breathing. Beautiful. Sit back for me. Now T2 in the chair, left side. For the upper thoracics, we need to come down on the joint, right? Because the angle of the disc is slightly superior to inferior. We still want to lift, but the lift is a little different. You're going down into the joint and lifting up. It's very, very subtle. 1, 2. You okay, man? Okay. Now, right there. Bring the shoulders back, please. There you go. The other thing is you really have to open up that chest. So bring those shoulders back. Good. Relax them down. Good. There we go. And we just want to come home run. Nice and easy. So today there was less crackly sounds. It was more specific, less crunchy, less scar tissue. Okay? Okay. Good. Stand up and walk, please. Now the fun one. Hold on 1 second here. Okay. Let's walk a little bit. 2 times, back and forth. Good. Okay, my dear, come over here now, please. Face down. You remember how we have to do this?
Yes.
Yes. 3. Now remember, we got to torque it a little bit. Good. 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 Oh, gotcha. All good. Thank you. That's the home run, lady. Good stuff. Fantastic. Never mind, you know better.
I know better not
you
to
know
fall.
better. You've been through this a couple of times,
Yes.
huh?
Yes, I do.
Let's walk it off, please. Good stuff. Have a seat, please. Good. And let's take a nice deep breath. I'll take that. You do realize you're here, right? You told me you've been waiting 2 years to come.
Yes.
You do know you're here, right?
Yeah.
Okay, just making sure. You know you're here.
I'm just letting it go.
Okay. Sounds good. T2 is clear. So what is clear?
Yeah, I wasted too much money on
On what?
coloring my hair.
What do you mean? You wasted too much money coloring your hair?
Yeah, just let my white hair grow.
Okay. You're all clear there. Now, let's feel back slowly towards me. All the way back. Muy bueno.
Nice.
All the way back. Nice. All the way
Nice.
back. Bam!
Yes.
I like it. Ears. No more ears.
No more ears.
That's done. Shoulder. Oh!
Ooh.
Woo! That was fun. Now, we're going to start on your ankles today, okay?
Okay.
More pain when I push on the inside here or on the back side?
The inside.
On the inside here?
Yes.
Okay. How about on the inside here?
Yeah, the inside.
More
Ouch.
right there.
Yes.
So both sides. But here's what we need to work on today. You feel the
Oh.
ankle?
Yes.
Yes?
Ouch. Yeah.
Hi. Hi. All right, so first, you've seen me do this, right? I gotta use a little lotion.
Okay.
You Samoan, you can handle it.
I've been dealing with the pain for so long.
So let's use a little bit of lotion. We're gonna start, so we're saying left knee, yes?
Yes.
I'm gonna start on right ankle.
Okay.
And the reason why is you've been compensating on right ankle.
Yes.
And I'm gonna pull on the right ankle, but I'm gonna use the board for the left one because we don't wanna disrupt that knee.
Okay.
Okie dokie?
All right.
Alrighty. Alright, let's see. So, starting with lotion, you can use oil, shea butter, whatever you want. And And we're just working out some of this periarticular swelling. Work towards the heart. Okay, up 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3. It's an AS talus medial tilt. That's what it is. I'm being a little nice today. Not too nice, but all right. Now, passive range of motion. As I'm dorsiflexing, I'm applying pressure A to P on the dome of the talus with my web contact to equalize the pressure of the joint, more on the medial side. That's where the fixation is. And let's set it now. La-di, da-di, da. Adria.
Oh,
Gotcha. Now we're going to use the board. AS talus, medial tilt. Posterior fit. Hi. Raise your left leg. I just want to put some thing there to stabilize it. You okay there?
yes.
Gotcha. Okay, my dear. Let's stand up slowly. Turn to the side, please. Take your time. I'm going to help you up. 1, 2. Awesome. Give it a second. Deep breathing. Whew. How was that for you?
Good.
Not bad, right?
Not bad. I can take the pain.
Hopefully it's not too bad, though. It's not.
No, it's not too bad.
Okay. Now let's see. Okay. You're going to walk once first with the stick, and then you're going to put the stick down, okay?
Okay.
There you go.
Ooh.
Ooh.
Oh
Look at
my
the
God.
smile.
This leg, it feels light. Like I can, when I don't know. I
Just
just
enjoy it. Walk and
Yes.
let's enjoy. It's lighter, it's moving a little smoother.
Yeah.
Okay. Now, what I'd like you to do, you can use your stick or the wall, raise your left leg and just stand on your right leg for a second.
Say it again.
Hold on to the wall, raise your left knee. Hold, keep it up. Because this is homework.
Oh, okay.
Okay, now just to see, can you raise your right knee? I just want to see. Right.
Yeah.
How's the pain in the knee?
The knee, I don't feel the
Come
pain
on.
as much.
Raise the right. No. It's no. Raise the right.
The knee, I don't feel
Keep
the.
it up, please.
I don't feel the pain on my knee, but it's just.
In the
that
glute.
pressure. Yeah.
That's the pain in your butt.
Yeah.
We'll deal with that. Don't worry about it.
Okay.
All right, we'll deal with that. Awesome. Have a seat, please. Right over here.
Oh my God.
Visit number
2. Whew.
Very good.
My foot, my ankle, it feels a lot better.
Now, I'm just getting things moving, okay? That's it. 5, 4, 3, 2, 1. Move your hand, please. There you go. Little buff and polish. Let's get that pain in your butt. All right, my dear. We're all good for today.
Okay.
You get your knee x-rays
Yeah.
today. Tomorrow we're going to go over those.
Okay.
Okay? And then let's see where we're at.
All right.
my
Thank you
dear.
so much.
Questions?
No,
Good?
I'm good. I'm good.
So we're on visit 3.
Yes.
We got our knee x-rays. I want to just quickly, we've already reviewed it, but I just want to do a quick review. And then we're going to get started.
All right.
Okay? When we're evaluating the femur and the tibia, we got both of these lines should match up. I'm not getting into how to draw these lines right now. I just want to go over the analysis. And what we can see is, I'm going to use the right as an example. This is the femur bone, this is the tibia bone, this is the fibula, this is the space in between. Now, what we're seeing is we're looking at symmetry. So the lateral meniscus are good on both sides. Medial, yes, there's more weight and stress being put on. I want you to notice this. Here's the patella here. There, that's the patella. So what happens when the femur rotates, takes the patella out to that side. Okay? Now, rotates that way. When the tibia rotates posterior, the interosseous space here becomes smaller. And the issue we're having is your left knee. And what we're finding here is that we have a posterior rotated tibia, and we have a little bit of that rotation of the femur. So we started, classically, when we have a rotated femur and tibia, look to that side for the sacrum, which is where we actually started with you. So that's kind of cool. Today we found different pressures, and I'm going to talk about it. But on this x-ray, yes, we can see the meniscus here is worn down on both sides. Let's look at the lateral. When we look at the lateral, there's still some joint space there, a tiny bit of arthritis in the back. The fibula needs to superimpose on the tibia. It's posterior, it's back. So what I'm going to work on today is going to be the left tibia and fibula today. Okay. That's what I'm going to work on, along with spine.
Okay.
We found C1, T2, T6, and today we found L3. Okay, L3, major nerve supply to the knee. So we can look at this different ways. We can look at structurally that the knee is part of what? Composed of the femur and tibia. Femur connects into the pelvis. Pelvis is part of it, and the sacrum form that foundation. We started on the foundation for the structural part, right? Now, neurologically, L3 is a major power there. It's also a major nerve supply to the hip flexor to get some power into this muscle. Okay?
Okay.
So, we're going to start on C1 first. Sit back for me, please. C1, ASR. And we just want to get a nice lockout. ASR. There you go. Home run. Now, next we're going to do T2 in the chair. Sit back for me, please. 1, 2. There we go. And again with T2, we gotta go down and lift. That's a home run, baby. Give that a second. Little spicy.
Yes.
You eat spicy food? You guys eat spicy food?
Yes.
Yeah. What's
I
the
use
main
a lot of
spice?
Cayenne pepper.
Cayenne pepper.
Yeah.
Face down, my dear, you remember the drill.
Yes.
All right, so now we're doing L3, ma'am, okay?
Okay.
That's 5, that's 4, that's the 3. There. Hi.
Oh!
That's a piece, gotcha. Little more, little more. Little more. There. Ooh. T6. Oh, gotcha. That wasn't too bad, was it?
No.
Okay. Let's go face down. And we're gonna start, I gotta use a little bit of lotion, okay? And I gotta break up some of that scar tissue on that left knee and the back side. So, here's what we're doing. We're doing bring this out. I got you covered back there. All right, so we need to do this lateral.
Let me scoot up a little.
Yes, ma'am.
Okay.
You okay?
Yeah.
Okay. All right. So we got to work that capsule back in, okay? Lateral to medial. Work that capsule. Good. 5, 4. As much as you can handle, okay? Can you are you okay?
I'm fine. Okay.
5, 4, 3,
Ouch!
2, 1. Hold on to the table, please.
I got it.
Hold on. You good?
Yeah.
All right, I got you. Posterior tibia. There we go. You good?
Yeah.
Gotcha.
Oh.
It's like a cardio session. Come off slowly, step back, step away from the vehicle, ma'am. Step away from the vehicle. Get yourself situated. Have a seat, please. I don't want you walking yet. And all I want you to do is this. Okay? Do that like 20, 30 times.
Okay.
While you're doing that, let me get situated.
That was a lot of work.
That was a lot of work. Let's check the spine and then I'll have you walk after, okay? Okay. We did C1. C1 is clear. T2 is clear. T6 is clear. Alrighty, L3 is clear. We do have a little bit of heat, but it's clear. Good. Shoulder. Over, around, down. Over, around, there. Oh, ears. Ears are done. Now let's walk. Anything different?
Yes.
Keep walking, talk, please. Tell her what's different.
It feels a lot lighter. My knee, my left knee.
Your left knee feels a little lighter.
Oh my God.
What?
I don't really feel that pain, sharp pain from my left knee.
Now walk without your stick, please. Bring me the stick. Thank you. And let's walk a straight line. Let's see. There's a little limp. Is that because of pain or
The
just
hip.
the hip?
The
Okay.
hip. Yeah, but
So knee's a little different.
yeah, the knee, I don't feel the pain that I had on my knee. It's just the
That's
hip.
the hip now.
Yeah, it's just the hip.
Have a seat. And last thing, let's do a little buff and polish here. So we're working on a posterior tibia left side. We switched to L3 today. Okay, for the knee. Now,
Yeah.
we'll see
I
what
don't
happens.
feel that pain that I came in for my knee, and my knee is a lot better.
You came for your knee,
but
right?
Yeah, knee and hip, but yeah, there's nothing.
Yeah.
It's just my hip that's giving me the pain, but feels a lot lighter. I
We're
mean,
getting there, right?
yes.
Squeeze.